Hi, everyone. I'm going to do something similar to what Bruce did and show the results from multiple studies that our group has been working on over the past 5 years, really focused on the unintended consequences of COVID policies on working age adult outcomes. Our project was funded by NIDA, and for whatever reason, we didn't have to take COVID out of our title or our aims, so it's a mystery. So we this is the research team, a lot of productive people. We had a very talented group of RAs and postdocs working with us. It's really been a team effort. We've published 19 studies over the past 5 years from this grant, and what this talk is going to focus on are the 5 that are most directly related to the aims. But we also published some policy briefs. And John mentioned in the beginning the National Wellbeing Survey, which would not have existed past its first year if not for the funding from NIDA. So we have 5 years of data available from the National Wellbeing Survey, which is a national survey of U.S. working age adults that covers a variety of different health outcomes, including physical health, mental health, psychosocial well-being, a lot of health behaviors. We included COVID modules in the first few years. It's geocoded, it has state level and county level identifiers and the restricted versions of the data that you can access through ICPSR. So if you're interested in working age adult health outcomes, I encourage you to check out those data. Okay, so in terms of the focus today, these studies that I'm going to summarize examine state and county COVID policies and their relationships to various working age adult outcomes. Including self-rated mental health, drug overdose, suicides, and firearm violence. And so I'm going to give you the general takeaways up front, just in case I run out of time here. But the first takeaway is the policies that limited in-person activities were generally associated with adverse outcomes. So specifically, states that had more stringent physical distancing policies predicted worse mental health outcomes, higher drug overdose mortality rates, and increased firearm violence. But they also predicted reduced male suicide rates, which were a function of reductions in male firearm suicides. A second takeaway is that when we looked at state economic policies, we generally found that they weren't associated with our outcomes of interest, with the exception of drug overdose rates, where states that had more robust economic support policies saw reductions in drug overdose. And then the third takeaway is that we can't lose sight of states' overarching policy context, that places went into the pandemic with already pre-existing conditions. And one of those pre-existing conditions were their policy environments. And we found that those overarching policy contexts measured over 3 decades remain a very strong predictor of working age adult mental health during the pandemic, net of the pandemic policy effects. Okay, so in our very first study, we looked at associations between states' COVID-19 physical distancing policies and self-reported mental health outcomes. We used individual level data from the National Wellbeing Survey, along with 12 specific state policies that captured physical distancing from CUSP. Reflecting the idea that policies bundled together, that they're highly correlated, that many were enacted in similar periods of time. We used Bayesian group index models to account for that high correlation between policies. And then we included a number of individual level controls, as well as the county's COVID-19 case rate at the time of the death rate at the time of the survey completion. So these are the 4 outcomes that we considered: worsened mental health, seeking treatment for anxiety or depression, meeting the clinical threshold for anxiety, and meeting the clinical threshold for depression. And you can see that the first 2 outcomes are based on questions that ask respondents to place the causal attribution to the pandemic itself. So about 38% reported that their mental health worsened due to the pandemic. Just over 18% reported seeking treatment for anxiety and depression. And about 32 and 31% met the clinical threshold for anxiety and depression. In terms of our Bayesian group index models, we found that various bundles of state policies predicted our 3 out of our 4 outcomes. The depression outcome was the one that wasn't significant. And overall, higher index scores, which denoted more stringent physical distancing, were associated with reporting worse mental health outcomes. So for example, a 1 standard deviation increase in the physical distancing index was associated with about a 36% increase in the odds of reporting that the pandemic worsened. And our takeaway, or one of our takeaways, remember this is very early in the pandemic, was that using stay-at-home orders as a proxy for physical distancing, which a lot of the literature was doing at the time, may have actually been underestimating the real impact of state policies in terms of physical distancing on mental health outcomes. In a sort of follow-up study, or something that we might think of as a confirmation study, which Ilya took the lead on, Ilya's in the room here today, we published this earlier this year. We were able to incorporate a much longer time series that captured both the pre-COVID and the during COVID periods. Here we also used individual level data, but this time using the BRFSS. And we looked at self-reported mental health, but we used a question that asked about the number of days people experienced poor mental health. It gave us a much longer time series than what we had with the NWS. And here we wanted to understand how states' overarching policy contexts were associated with working age adult mental health over this big 30-year period. But also whether the pandemic disrupted that long-term association between states' overarching policy context and mental health. Okay, so these maps give you a sense of how mental health at the state level changed between 1993 and 2022. In 1993, the average number of days of poor mental health was 3.1 compared to 5.2 days by 2022. And in 1993, an average of 4% of the population reported extreme distress, which is having 30 out of the last 30 days in poor mental health. That percentage was up to 7.4% by 2022. And we use the same legend in both of these years, so you can sort of see those darkening states are states where the share of the population experiencing poor mental health was increasing. So our regression models for this study estimated the association between these overarching state policy contexts, which we got from the Caughey and Warshaw index, which combines literally dozens of state policies across a wide variety of domains. And here we're showing the average marginal effect for a 1 standard deviation increase in that policy index. So higher means more conservative policy environment. And so what you're seeing here in this first column is that for the pre-COVID period, which spanned 1993 through 2020, each approximate standard deviation increase toward more conservative state policy context was associated with 0.283 more days of poor mental health. And each approximate standard deviation increase in that index was associated with about a 0.5% increase in extreme distress prior to the pandemic. So then the question is, what happens when the pandemic hits? Do these relationships change? And in fact, no. During the pandemic, each standard deviation increase in this overarching state policy conservatism was associated with 0.27 more days of poor mental health and about 0.36% greater likelihood of extreme distress. Okay, but then in these models, we also looked at those COVID policies, the indices that I was talking about earlier, physical distancing index and economic support index. And we found that more stringent state level physical distancing policies during the pandemic were associated with worse mental health. So confirming the results of that earlier study that we did. But the big takeaway here is the pandemic did not disrupt the long-term association between states' policy context, overarching policy context, and mental health. So in this paper, we shifted from individual level mental health to county level drug overdose rates, and we asked how states' physical distancing policies and economic support policies during COVID were associated with county level drug overdose rates. We used an interrupted time series design that me or Emily or Ilya probably can talk about later. And we estimated separate models for males and females. So these are just the trend lines. Males are in blue, females are in red. And what they show is that there's a spike in overdose rates in the early months of the pandemic, but then there was a return to pre-pandemic trend by the fall of 2020. And in our interrupted time series models, we found that for physical distancing policies, a 1 unit increase in that average monthly physical distancing index was associated with an increase in drug overdose rates for males of about 14%, or 15%, and for females of about 14%. More robust economic support policies did matter here. They reduced drug overdose rates by about 3% for a 1 standard deviation increase in the index. But the combined effect of these policies together meant that more stringent economic support policies or more liberal economic support policies could offset the adverse effects of the more stringent physical distancing policies. We also considered changes in suicide. Emily Weavers, who's in the back, led this study. So nationally, suicide rates were increasing before the pandemic, which you can see in the line chart. But suicide rates for both males and females kind of dipped during that first year of the pandemic, despite all of this fear that that these rates would go up. But there was considerable state level variation in that trend. So rates did increase in some states while declining in other states. So we wanted to try to understand this. And so for this paper, we use those same physical distancing and economic support indices, but this time we're looking at suicide at the state level. And we use monthly suicide rates from 2009 through 2021, that same ITS design that we used in the last paper. And here we found significant results only for physical distancing and only for male suicides. And that was specifically driven by the fact that increase in physical distancing stringency was associated with reduction in male firearm suicide rates. But there was a caveat here, and that was the association was strongest at the beginning of the pandemic, and it was no longer significant by December of 2022. So the relationship that these physical distancing policies had was sort of restricted most acutely at the beginning of the pandemic. And then the final study is one that just came out, actually. And in this study, we're using Rita Hamad's county level COVID policy data. So thanks to the consortium for that as well. And so we collected data on firearm violence from the gun violence archives. And so we're looking at the association here between county level physical distancing stringency and county level gun violence incidents. And this is just a trend line showing changes over time in gun violence incidents. You can see clear seasonality effects, which we account for in the models. Here are the results. And the takeaway here is that all of the county level policy interventions, which included closures and masking, were associated with an increase in gun violence. Okay, so both indoor and outdoor masking requirements and partial and total closings were associated with increased gun violence. That masking requirement had a particularly large association with gun violence. So indoor masking requirements were associated with a 28% increase in gun violence over this period. But state economic support was not significant. Okay, so the overarching implications of the takeaways from these 5 papers, we know that the COVID policies did reduce spread, reduce cases, reduce COVID mortality. But from our collective studies, we also showed that the policies had some unintended consequences. Particularly the policies that restricted in-person interactions did seem to have adverse associations with working age adult mental health and drug overdose and firearm violence. So then what's the lesson for policymakers? I mean, I don't know. It's difficult. It's maybe even impossible to optimize policies, right? There are always going to be unintended consequences. There are always going to be winners and losers. I don't think any of our projects can identify one specific thing that policymakers can do next time around to maximize or minimize the total number of deaths lost. Sorry, Bruce, it's you. So I just think it's difficult to precisely calibrate our policies to guarantee the least harmful impacts. And maybe that's something that the public just needs to come to accept, and us as scholars just need to come to accept. And then finally, despite the shock of the pandemic, and we did a lot of research on pandemic policies, but we need to make sure not to lose sight of pre-existing context and what was in place prior to the pandemic, in our case, the state policy context, and how those continue to be important and continue to matter during the pandemic and continue to matter. Yeah. Thank you.
Thank you very much.